working fine. Thank you. Thank you so much. So as Chris said, I've been there, and I'm a biomedical engineer at doing biomedical engineering at Wichita State University. So I'm senior year, so I'm graduating this December. So I worked at Salina Regional Health Center this summer as an intern. So quick background of my facility. So it was located in North Central Kansas, as you can see in the map, and it is a general medical and surgical facility founded in 1995, and it provides full service of medical care to our emergency service care, and also it provides a variety of specialty service, and also it has 21 affiliated clinics in Salina and surrounding communities, and it has 900 employees on site. So our main goal of Salina Regional Health Center is to reduce solid waste and also find a new disposal method for many types of waste, and also introduce a new culture of awareness. So this is the first time Salina Regional Health Center working with PPI. So to achieve their goals, I concerned about source reducing, reuse, and recycling options. So this is a quick overview of my projects. I did 6 projects, but the last project I didn't have much time to complete it, but I gathered all the important information. So my first project is biohazardous waste reduction. Salina Regional Health Center disposes biohazardous waste in 2 methods: through facility incineration and also through the sterile cycle regulated medical service, disposal service. So I looked for facility incineration waste, and I didn't see much options for waste reduction. So I looked for other options, and through the observation, I saw like general solid waste disposal in regular biohazardous waste bins. And also I saw that facility use disposable sharp containers, and it adds a lot of waste through disposal through a sterile cycle. So first solution is the facility personnel can do pediatric supervision and educate employees for proper disposal. And also they can separate biohazardous waste bins from the solid other waste bins, and also place posts displaying what they can dispose in biohazardous waste bins. The other option, a solution I found is reusable sharp containers. So they use like 678 reusable sharp containers. So this adds a lot of waste into biohazardous waste. And I found like a sterile cycle, they have a reusable sharp container option. So what they do is they provide reusable sharp containers to the facility, and they take them and they wash it, disinfect it, and also run for quality check and send back to the facility. So I did a quick comparison of single-use sharp containers and also reusable sharp containers. So sterile cycle sharp containers agreement is for 3 years, and their containers can be used for 3 years, and after that they can renew the agreement. So if the facility use like single-use sharp containers, the purchasing cost for 3 years is $93,110. Reusable sharp containers are a little bit expensive, but it is just a one-time purchase. So it costs like, for 3 years, it costs like $8,312. So for the disposable cost, it costs $10,519 for single-use sharp containers. But reusable sharp containers, they have a monthly service charge for $50. So it costs like $1,800 per 3 years. And additional cost, they charge for wall mounts, installation, and container damage. So I assumed it will be like 10,850 for 3 years. So you can see like cost savings. It could be 27,556 per year. And this could reduce biohazardous waste by 6 tons, and it could reduce carbon dioxide emission by 12.95 tons per year. So this is my second project, blue sterile wrappers reduction. So manually and mechanically cleaned surgical instruments are packaged in FDA clear products. So usually they have sterilization pouches, sterilization wraps, and also sterilization containers. So sterilization containers are reusable ones, and pouches they use to package lightweight single instruments. Blue sterile wraps and also containers used to package surgical kits. So I calculated from blue sterile wraps, it at 3.87 tons for disposal per year, and purchase cost and disposal cost is 31,151. So I considered what solution we can go with, and I think about source reduction. But currently, Salina Regional Health Center, they use a lot of sterilization containers, but they don't have how many containers they have, exact number. So, and it is hard to pre-estimate how many containers to buy to reduce how much of waste. And also, sterilization containers are very expensive. So I looked for recycling options, and I found like Salina Regional Health Center use Halyard brand blue wraps. So the Halyard company, they provide a blue renew program, and they're working with Blue Corn company, and they collect clean blue wraps, and they send to the processing facility, and they produce pallets and other stuff using blue wraps. So I contact Halyard agents, and they said they are collecting used blue wraps through collector. So the collector, it costs like $3,010 annually, because they charge like $35 to collect 85 to 100 leaves of blue wraps. So, but if Salina Regional Health Center do like dispose it to hometown disposal, it costs like $174 annually. So recycling is not a good option because it costs a lot. So this is the third project, kitchen tray liner paper reduction. So some of the hospitals, they use tray liners, but some of the hospitals, they don't use tray liners. So one of our interns, I don't remember his name, and he worked in NMC Health, and when I asked him, he said they don't use tray liner papers. So tray liner papers are eye-catching, and it can enhance patient satisfactions. But anyways, it add 2.33 tons of waste due to tray liner papers, as my calculations. And tray liner papers are not recyclable because they are contaminated with food. So for a month, my facility used 10,500 tray liner papers, and it costs 540, sorry. So they use they use like 126,000 tray liner papers per year. So if they eliminate tray liner papers, they can reduce 2.33 tons of annual waste generation, and also they can save 6,272 cost, savings. And they can reduce 14.33 carbon dioxide emission tons, metric tons per year. So this is my fourth project, disposable suction canister waste reduction. So suction canisters used to temporarily store bodily fluids. I found like more of the suction canisters used in OR and ICU. So these suction canisters are disposed in biohazardous waste bins. So I found some ways to reduce this suction canister waste. Because of suction canisters, just in OR and ICU, it adds 1.16 tons of biohazardous waste annually. So I found fluid management system. So one is MD Technologies and Environment one, and it costs 2,500 and to 6,000 depending on the model. So from this one, we can reduce suction canister waste generated in OR and ICU. And the other option is Striker Neptune Waste Management System. This one costs 22,500, and this is a portable one. And this has a technique that it, after you use up to 20,000, so it can clean itself. It has a system to clean itself. Through this one, my facility can reduce biohazardous waste by 1.16 tons, and annual cost savings is 6,164. And they can reduce carbon dioxide emission by 4.81 metric tons. So this is my fifth project, disposable blood pressure cup waste reduction. So since blood pressure cups are invasive product, we can use reusable blood pressure cups. Currently, my facility is this facility switched to Welch Alien disposable blood pressure cups. So I thought to do research on Welch Alien reusable blood pressure cups. So I got all the information for Welch Alien reusable blood pressure cups. So reusable blood pressure cups, they have to clean it after every use. And the cleaning process is easy. They just have to use like 70% isopropyl alcohol preps and just leave for air dry. I did a comparison between single use and reusable. So Welch Alien has like a reusable blood pressure cups that is usable for 2 years and also for 3 years. I just concerned about the 2-year one. So for 2 years, if they purchase like single use one, the purchasing cost is 31,087. And reusable ones just for 2 years, it costs like 3,633. And disposal cost is 67 from the single use ones. And reusable ones doesn't have any monthly or annual disposal cost for 2 years. For the total cost, you can see like single use for 2 years, it costs like 31,154. For reusable one for 2 years, it costs 4,565. So if they switch to reusable blood pressure cups, they can save 1,294 per year. And also they can reduce 0.75 tons of solid waste. And also they can reduce carbon dioxide emission by 0.31 metric tons. This is the project 6, cafeteria and kitchen waste reduction. So we considered, we found like cafeteria and kitchen produce pre-consumer cafeteria waste. pre-consumer kitchen waste and post-consumer cafeteria waste. And this is the summary of audit we did. So we found like food surplus 9.5 just from the kitchen, and unopened food 10.6 kitchen, and these are we calculated for year. I forgot to mention it. And compostable food and non-food 62.7 per year, and switchable plastic cutleries and styrofoam 3.7 tons per year, and recyclables 9.7 tons per year, and actual trash we found is 11.5 per year. So so we recommend like food donation and composting, recycling, and options. And I in Salina, currently they don't have food composting options. But when I called someplace called Cancer Organs, yeah, and they are in the process of getting approval from KDHG to composting food waste. So, and they said they will get approval in a couple of months. So my facility can compost food waste to cancer organs in a few months. So this is the summary of all of my projects. Biohazardous waste reduction project can reduce 6.505 tons of biohazardous waste, and kitchen tray paper liner project can reduce 2.33 tons per year. Suction canister project can reduce 1.16 tons of hazardous waste per year. Disposable blood pressure cup project can reduce 0.75 tons per year. And cafeteria and kitchen waste reduction, I just concerned about food surplus reduced by 1/3, and unopened food reduced by 1/3, and recyclable waste reduced by 1/3. So then they could reduce 9.9 tons of solid waste generation in cafeteria and kitchen. So through all these projects, 16% of biohazardous waste could be reduced, and 3% of solid waste could be reduced. Any questions?
They said anything about implementing your recommendation?
I highly recommend to implement disposable sharp containers, because I know a lot of waste produced from the single-use sharp containers, and it was like 12,000 something per year. So, and also I recommend to implement tray paper liner based generation, and also suction canisters. That's a great option because they can reduce a lot of disposable suction canisters they use for beer. And also it could reduce biohazardous waste, because biohazardous waste disposal is very expensive. It costs like more than 10 times than just a regular solid waste disposal. So it is, and also blood pressure cups. So I recommend to implement it in non-critical patient clinics and cups. So.
Do you think, did they say anything about implementing them? Are they on?
When I talked with facility director, he said he's going to discuss about the disposable sharp containers project. Because it would save a lot of money, and also reduce both sides.
Maybe I just missed it. What was the purpose of the tray liners? So you said some parts or some branches of the hospital were using it, but some were not. Is it like for sanitary reasons or to make it easier to clean?
Not sure. I asked from the kitchen staff, but they didn't say anything. But anyways, they wash trays.
Okay. So they wash all the trays no matter what.
Yes.
Some they still
No,
use paper
yeah.
liners. Okay.
So I'm not sure about it.
It's pretty much aesthetics,
Yeah.
We've seen it some other place, a few people just think, ooh, there's a big liner on this tray.
It must be cleaner.
It, looks cleaner.
Yeah, okay.
So it really serves no purpose other than that. Sometimes it serves an education purpose, like they might have some education on there.
And I saw like, when I search in Google, some places they use like embroidered, trays, so it looks nice. So.
Thank you. And so could you flip back to your chart? I just didn't get to see it up. And you did a great job in that, and you spoke up, you did really, really well, but then you trailed off when you were answering Phil's question. I was like, oh, I was trying to hear that. So you said for sure they're going to do the reusable sharps containers, right?
Yeah.
Great. That is the biggest savings you've got there. And then you said the next one was probably, they would do the tray liners, because we like to follow up. And we have to record all this data that gets implemented, not necessarily recommended. And so, which one of these do you think they wouldn't? I know you didn't get a chance to do all the cafeteria work, but are there any of these that they're not planning to implement right now?
For the blood pressure cuts thing, because when I asked for the purchasing department, they said they are going to switch to Welsh Alien disposable ones that is more cheaper than the ones they use now. So I talked to the facility director that I'm doing research about reusable Welsh Alien ones, because so then they can easily switch to reusable ones. But I'm not sure whether they're going to, but I hope they can do.
So that is so interesting to me because I worked in healthcare. My previous career, I was a nurse. And so I worked many years in healthcare as a nurse. And so when you brought this to me, I was happy to be working with you. Then I was like, really? And then someone on our team confirmed that, hey, yes, I was in the hospital recently and they use these disposable blood pressure cups. But I thought that was so interesting and kind of sad since COVID. But, you don't usually have to even you went to the step of, adding in the cost for disinfecting them, right? But typically that doesn't happen like in your doctor's office and things. I mean, I've never seen them because it's skin to skin unless you've got somebody with an infection.
I mean, I guess one simple question would be, what piece of information or data that you collected surprised you the most?
Disposable sharp container one, because actually the facility can reduce like 13% of their hazardous waste. So, and I think it could be more than 27,000 they can reduce, because I assume that for the installation and also installation and a few assumptions, but usually the companies they give free wall mounts and stuff. When I asked from the purchasing department, so they said they provide free wall mounts since they buy disposable ones. So probably, since I assume like cost for them, but probably
The savings might be even.
yeah, more than that.
Yeah.
So can you clarify for me, the reduction is the fact that, or the reduction in the biohazardous waste is the fact that when they use the disposable waste containers, that those actual containers become biohazardous waste. And so by not using the disposable containers, that's where the reduction is coming from.
Because this terrace cycle, they have a reusable containers. So they just inject whatever the content and they clean it, they disinfect them and run for quality inspection and send the same containers to you. I mean, If not, if they use like disposable ones, they dispose with the container. So, I mean, they incinerate with the chemicals.
And Vindya, correct me if I'm wrong, but the suction canisters. That, I mean, they would take those full suction canisters and just put them in the red bag.
No, actually, in Salina Regional Health Center, the suction canisters, that if they collect bodily fluid like gastric juice or something like that, they just dump it to the sink in college utility room and just dump the empty container in for hazardous waste bread bags. But if they are contaminated with blood or if it is completely blood, they use solidifier. They have a bottle, it's called solidifier, and they put the solidifier into the fluid and it solidifies. And then with the solidified fluid, they dispose for canister in a bread bag. So it adds a lot of weight with the solidified fluid. But when I went to the floors and when I talked, they said mostly they are like body fluid, like gastric juice, something like that. But in surgery, it's mainly blood, and I see that they said they contaminated with blood. So they dispose with blood, I mean, with solidified blood and fluid in bread bags. But for this waste reduction, I just calculated with empty containers. I considered that. I didn't consider the weight of the fluid, the disposal rate back, but it could be more than that. They could save it through go to these options.
Excellent, that's great. One of the things that we always try to do is when we train our interns is to say, please be conservative with the numbers. We don't, you may find out those numbers are 30% below. Get as close as you can, but never be exaggerating with the numbers. So typically companies are going to see bigger savings. So in this case, definitely. And so I want to compliment you on being conservative with those numbers. Great results.
Thank you.